Most people start learning medical billing, but they don't understand the system behind it. And that's exactly why they get confused later. In the last video, you understood what medical billing is. But now a bigger question comes. Where does medical billing actually fit? What system are you working in? Because if you don't understand the system, you will always feel lost. And that system is the US healthcare system. Don't worry, I'm not going to make this complicated. In this video, that is lesson third of complete medical billing series, I will break it down in the simplest way possible so you can understand how everything connects. Before you become a medical biller, you need to understand one thing very clearly. Medical billing is not a separate job. It is part of a bigger system. If you don't understand that system, you will only memorize steps without understanding them. But once you understand how the system works, everything starts making sense. So in this video, we will not go deep into complex details. We will build a simple, clear picture in your mind so you know exactly where you fit as a medical biller. Let's start with the basics. The US healthcare system is the complete network of people, organizations, and processes that provide medical care to patients. This includes doctors, hospitals, clinics, insurance companies, and supporting staff. But here is what makes it different from many other countries. In the US, healthcare is not free in most cases. Patients usually pay through insurance. That means there is always a third party involved between the patient and the doctor. And that third party is the insurance company. This is the reason medical billing exists. Now let's understand the main players in this system because everything revolves around them. First, we have the patient. The patient is the person who receives medical treatment. Second, we have the provider. The provider is the doctor, clinic, or hospital that gives the treatment. Third, we have the insurance company, also called the payer. The insurance company is responsible for paying the medical bill. And finally, we have the medical biller, which is you. You act as a bridge between the provider and the insurance company, making sure that provider gets paid correctly. Now let's understand the most important part, the flow of money. A patient visits a clinic and receives treatment. Instead of paying the full amount, the patient uses their insurance. The medical biller then prepares a claim and sends it to the insurance company. The insurance company reviews the claim and decides how much to pay. If everything is correct, payment is issued to the provider. If something is wrong, the claim is denied or partially paid. This is where your role becomes critical. You make sure the claim is correct so the provider gets paid without delays. Now let's talk about insurance in a simple way. There are two different types of insurance in the US. Some are provided by the government and some are private. Government programs include plans for elderly people and low-income individuals. Private insurance is usually provided through employers or purchased individually. You don't need to memorize names right now. At this stage, just understand that different patients have different insurance plans, and each plan has its own rules. As a medical biller, you will learn how to work with these different plans step by step. Now let's connect everything. A patient visits a provider, the provider gives treatment, the insurance company is responsible for payment, but the insurance company will only pay if everything is documented correctly. This is where medical billing comes in. You take the treatment information from the provider, convert it into a proper claim, and send it to the insurance company. Then you track the claim, follow up, and make sure payment is received. So you are not just doing a task, you are controlling the financial communication between the provider and the insurance company. Many beginners make a mistake. They try to learn steps without understanding the system. And because of that, they get confused when something goes wrong. But when you understand the system, you can think logically. If a claim is denied, you can understand why. If a payment is delayed, you can trace the issue. This is what separates a beginner from a professional. A professional does not just follow steps, they understand the system behind those steps. At this stage, don't try to memorize everything. You don't need to remember every type of insurance or every rule. Just build a clear picture in your mind. There is a patient, there is a provider, there is an insurance company, and there is you. The patient gets treatment, the provider creates a bill, the insurance company processed it, and you manage the entire flow. If you understand this clearly, you are already ahead of most beginners. Now you have a clear understanding of the US healthcare system at a basic level. You know who is involved, how money flows, and where you fit in. This clarity will make everything clear in the coming videos because from now on, when we talk about claims, payments, or denials, you will understand exactly what is happening and why. If you are serious about learning medical billing step by step, subscribe to the channel and turn on notifications. In the next video, we will go deeper and understand the key players that are involved in the system. And once you understand that, you will start thinking like a real medical biller.